Welcome to the Johns Hopkins Living Kidney Donor Education for Incompatible Kidney Transplants. Today we will be reviewing blood type and tissue incompatibility and options available for donors. We will review the benefits of kidney paired donation, or KPD. We will go over the process for paired donation and associated risks. We will discuss non-directed donation, and finally we will review the required consents. There are two types of incompatibility. The first is blood type incompatibility. This is when the donor and recipient are not the same blood type, or they are incompatible blood types. For example, blood type O is a universal donor and can give to all blood types. A blood type A donor can only give to a recipient who is blood type A or blood type AB. The second type of incompatibility is tissue incompatibility. This is when the recipient has antibodies to the donor's proteins, or HLA. This can cause rejection. We compare 6 proteins, or HLA, when determining the tissue match of the donor and the recipient. Blood type and tissue type incompatible transplants can result in a higher risk of rejection and shorter survival of the transplanted kidney. So we prefer to do a compatible transplant if possible. By choosing to proceed with KPD, recipients who have incompatible donors have the opportunity to have a compatible transplant with less risk of rejection. Live donor transplants are better and last longer than deceased donor transplants, so the KPD program is a good option. Recipients can wait on the deceased donor list for 3 to 7 years. Recipients with blood type incompatible donors have the opportunity to have a compatible transplant, and recipients who are highly sensitized or have DSA have the opportunity to find a donor that is a better match. At Johns Hopkins, we have several options available for incompatible donor-recipient pairs to help find the recipient a compatible live donor transplant. The first option is the Kidney Pair Donation Program, or KPD. In this program, donor and recipients are entered into the KPD registry database as a pair to look for the compatible donor for the recipient, or a more compatible donor for a sensitized recipient. At the same time, the donor is also matched to another recipient. This can be from a different transplant center in the registry database. Johns Hopkins will activate donor-recipient pairs in all KPD registries in which we are participating. Those include the National Kidney Registry and the Alliance for Paired Donation. Another option for donors is the voucher program or advanced donation. In this program, the donor donates when ready, and then the recipient redeems the voucher for a live donor kidney from the KPD registry. In certain instances, we can use desensitizing protocols for direct donation of an incompatible donor. Research studies are emerging that have therapies to address incompatible transplants for all of our patients. All donors and recipient pairs who have been evaluated and cleared by their transplant center are eligible and can be entered into the KPD registries. Donor and recipients who are tissue and blood type incompatible can be entered. Compatible pairs can also be entered for the opportunity to find a younger donor, a better tissue matched donor, a better kidney size, or they may choose to do this just to help other people as well as their recipient. Non-directed donors and voucher donors are also eligible and can be activated in the KPD. KPD recipient donor pairs must meet the same medical, psychosocial, and ethical selection criteria used for standard living donor transplants. Donors are fully evaluated by the donor team. Specific KPD education is provided when the donor is evaluated if they are incompatible, if they are compatible, or a non-directed donor. If the donor and recipient agree to proceed with the KPD, they will sign consents. A KPD registry is a confidential computerized database of registered recipient donor pairs waiting to be matched in the KPD. Once the pair is entered into the KPD registry database, we will ask the donor to send in a buccal swab sample for future cross-matching with recipients in the registry. A kit will be sent to the donor's home address, and the sample should be sent back to the registry ASAP. The time to find an acceptable match is dependent on many factors, including the recipient and donor blood types and recipient's unacceptable protein profile or donor-specific antibody. It can take 3 months to a year or more to find a match. Matches can occur as a chain or a direct exchange with another pair in the registry. The recipient transplant hospital determines if the matched donor kidney is appropriate for their recipient. This is an example of two incompatible pairs in the KPD and how they are matched and swapped so the recipients get a compatible kidney. Example 1 is an ABO incompatible pair. The donors who are not compatible with their recipient give to the recipient with the same blood type. Blood type A donor will donate to blood type A recipient. Example 2 is one ABO incompatible pair and one tissue incompatible pair. The two donors are swapped, so each recipient gets a compatible kidney. This is an example of a KPD chain. It is started by a non-directed donor or a voucher donor that is matched with a recipient in the KPD registry. This enables multiple patients to be transplanted by one donor coming forward. Once you are entered and active in the KPD registry, you will need to wait for a match to be made. We don't know how long that will take. The Johns Hopkins team will notify you when a potential KPD match has been identified. We will give you a tentative date for your donation and discuss the details involved, lab work, pre-op appointment, etc. KPD recipients and donors may decline a match at any point in time in the process. We would then re-enter you back into the database to look for a future match. KPD recipients and donors have the right to withdraw from the participation in the KPD registry at any time for any reason. Johns Hopkins wants to achieve the best outcomes for our patients and ensure the safety of both donor and recipients. Unexpected events can happen anytime. Successful transplantation or function of the transplanted kidney is not guaranteed. It is at the discretion of the Johns Hopkins Hospital transplant team to proceed with or stop surgical removal or transplantation of the donated kidney based on factors such as, but not limited to, donor or recipient medical instability or medical or surgical concerns regarding the donated kidney. It is very important that you trust your Johns Hopkins team to make the best decision for you if there is an unexpected event. A failed KPD exchange is when a donor donates but their matched recipient does not receive a transplant. Unexpected events that might prevent donation or recipient transplant can include the following. A candidate might not receive a transplant because of an unexpected issue with the matched donor's kidney found during or after surgery. An event may occur in the operating room that makes it necessary to stop a donor procedure. In this case, a recipient would not receive a kidney. In the KPD program, if a donor or recipient surgery has begun, the surgery will continue even if another surgery in the match must stop. If it is necessary to stop a recipient surgery, a kidney would be available. This kidney would be given to a recipient on the deceased donor waiting list according to the Johns Hopkins Hospital allocation policy. When there is a failed exchange, the KPD registry, which organized the match, and/or Johns Hopkins Hospital will attempt in good faith to match an altruistic donor to the recipient or end a future chain with a donor going to the recipient who did not receive a kidney. However, a match is not guaranteed. There are no extra wait points on the deceased donor list for recipients in a failed kidney paired exchange. Donors cleared for donation and entered into the KPD registry by Johns Hopkins will donate their kidney at Johns Hopkins. You are our patient and we will be responsible for you. Your kidney will be shipped to your matched recipient center to be transplanted. An experienced courier company is contracted to transport the kidney in collaboration with the transplant center and the KPD registry. There are some risks associated with transporting kidneys. There could be a possible delay in function of the organ caused by the travel time to transport a kidney between donor and recipient institutions. For example, there could be traffic issues, there could be flight delays, or due to weather concerns. There is possibility there could be accidental damage or complete loss of organ during transport between donor and recipient institutions. A GPS device is used to monitor the kidney during transport from both the transplant center and the KPD registry. KPD pairs remain anonymous prior to kidney donation. The identity of the donor and recipient will remain confidential and their healthcare information protected during the evaluation, transplantation, and post-operative process. The KPD registry database may contain information on each individual such as date of birth, social security number, age, sex, race, and most importantly, medical and laboratory information that will be utilized for the purpose of matching potential compatible pairs. Recipient and donors must agree to share protected health information with other transplant hospitals participating in the KPD program. If donors and recipients want to have communication after their recovery, this can be facilitated through their transplant coordinator if both patients agree. A non-directed donor is someone who comes forward to donate to anyone. They do not have a specific recipient that they want to help. They go through the same process as all other donors, including medical, surgical, and psychosocial assessment. At Johns Hopkins, all non-directed donors talk with our psychiatrist as well as the social worker. At Johns Hopkins, non-directed donors can be entered into the KPD to find a recipient to maximize their donation. They will start a chain enabling multiple people to be transplanted and maximizing their donation. They can also be matched with someone on the Johns Hopkins deceased donor list or involved in an in-center exchange if a match is available. There are donor assistance programs available through the KPD organizations for donors that qualify to help them with financial burdens. Some of the programs and supports available are reimbursement for travel, wage, dependent, and elder care. You can speak with your nurse coordinator or social worker about this possibility during your evaluation. All patients who are being entered into the KPD will need to sign consents. There is a consent for participation, a consent for shipping your kidney, a consent for bridge donation if applicable, and also a consent for sharing health information. Also, non-directed donors have an additional consent to sign. We will ask you to sign this form when you come to clinic, documenting that you have listened to this presentation. Your coordinator and our providers will provide additional information and can answer any questions when you come in for your full evaluation. Thank you for choosing Johns Hopkins Transplant.